Hello, everyone. How's everyone doing today? Hey, everybody. How's everyone doing today? It is Sunday, October 8th. It is 3:04 p.m. I'm going to wait just a few more moments and let some folks come on. This is our weekly Talk with the Doc session. I'm Dr. Nicole. You all know who I am. And I'm so glad to be here today. Like I said, I'm going to just wait a few more moments and let some folks join in. Please invite your friends. Let them know that today we're going to be talking about breast cancer, okay? It is October. It is Breast Cancer Awareness Month, and we're going to do everything we can to save the tatas, right? Save the tatas. A lot of times when we talk about breast cancer, we're assuming it's women, and we'll talk about why that is, but breast cancer does affect men as well. But all in all, we want to save the tatas with everyone. So we want to discuss breast cancer and breast cancer awareness with everyone. So please invite your friends, join in, and we'll get started here in one more moment. I hope everyone's had a great day. It's been unusually warm and muggy here in South Carolina. I'm not sure if that's got anything to do with the hurricane that's hitting down on the Gulf. We do send our prayers down that way and hope that everyone is safe and that there's not that much damage. But yeah, it's really, really warm and muggy and hot here in South Carolina today. All right, just one more moment here and we'll go ahead and get started. I found some great little breast cancer awareness slogans. Let's start with those, okay? In a moment. Let me first introduce myself. For those of you who don't know who I am, I think everyone does though. I'm Dr. Nicole. I'm a board certified family medicine physician. I specialize in treating and preventing chronic medical conditions and explaining those conditions to everyday people in terms that they can understand, okay? Through my books, my seminars, my concierge medical practice, I help pastors, their congregations, and everyday people live their best lives by transforming their mind, body, and spirit so that they can have a greater impact on their communities and those around them. All right. Thanks for joining me today, but I would like you to follow me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DrNicoleDO. All right. So let's start with some breast cancer awareness slogans. Again, like I said, it's October. It's Breast Cancer Awareness Month. And so we are standing in solidarity for all of those who have been diagnosed with breast cancer, those who have passed away from breast cancer, and anyone who might get breast cancer in the future. All right, we stand in solidarity with you, and we say that we support you, and we're praying for you, and we're going to learn a little bit more about it today so that we can do everything we can to support you. So what are some slogans? Show you care, be aware, all right? Be aware of breast cancer. Breasts, they can use your support. I love that one. I think I can. That little engine that could? Yes. The breast is yet to come. We know that, right? The best is yet to come, but the breast is yet to come. Big or small, save them all. We're going to save them all. One fill a day can keep the doctor away, and that's true. Although one fill a day might be a little bit much, but we should be doing our own self-breast exams. All right, check your bumps for lumps. Okay, check your bumps for lumps. And we're thankful. Thanks for the mammaries. Like memories? Yeah, the mammaries. We got pink power. Think pink. Ready, set, go pink. Fight like a girl. I love that one. Fight like a girl. Fight the fight and find the cure. And we're walking my buns off for the boobs. Those are those who do the breast cancer walks. I've done a couple before in solidarity with a couple of people that I know. My old nurse, Miss Margie, love her to death. Love her to life. She's still alive. She is a survivor, a breast cancer survivor. I think we're going on 3 years now. Team Margie. Yay, Margie. Love you, Margie. All right, so what is breast cancer? What is breast cancer? Breast cancer is it's where a group of cells abnormally grow, and they form a tumor in the breast. Okay, we do know that the breasts, of course, they sit on our chest, and there's a muscle that covers the ribs. In each breast, there are 15 to 20 sections, or what we call lobes, and in those lobes are smaller things called lobules, and in those lobules, that's where they produce milk. Okay, so like when you're breastfeeding, the milk comes out of those lobules. And then there's fatty tissue in the breast as well. All right, so the breast is basically made of two things. You got the actual breast tissue, which are the lobes and the lobules, and then you've got the fat that are in the breast. As we get older, we lose some of the dense breast tissue and we get more fat, okay? So what are some of the facts about breast cancer in general? Breast cancer is the second most common cancer in the world. Second most common, all right? So that's why we make such a big deal about trying to become aware of breast cancer and explain to people what breast cancer is and what you can do to help fight it, because it is the second most common cancer in the world. It ranks as the 5th cause of death from cancer overall, okay? 5th cause of death. It is the most frequent cancer in women. Okay? We do know that. And like I said, as you get older, the incidence, how often it happens, does increase with age. And actually, all women are at risk. There are some people that are more at risk than others. So let me explain who is more at risk. So we see it more commonly in Caucasians than we do in minorities. Like I said, as you get older, you have a higher chance of getting breast cancer. Of course, women have a higher chance. Not to say that men don't get it. Men do get breast cancer as well. But of course, women have a higher chance and a higher incidence of breast cancer. Family history is very, very big. So if you have what we call a primary relative basically means somebody that's like your mother, your sister, on that first level of your family tree, mothers and sisters, then you have a higher incidence and a higher chance of getting it. Then if you kind of go up, if you had grandparents, a grandmother that had it or has it, if you've got cousins or aunts that have it as well, or uncles or your father, then you have a higher chance of getting it as well, okay? If you have been diagnosed with breast cancer in one breast, then you have a higher chance of getting it in the other breast as well. And that's why sometimes when people have a specific gene for that can cause breast cancer, they go ahead and remove both breasts. Then they don't have to worry about it, okay? Because you can get the cancer in one, and then it get treated and go away, and then later on, you have a higher chance of getting it in the other breast as well, okay? When you have your first period, actually increases or lowers your risk of breast cancer. So people who have earlier periods, so if you had your period before the age of 12, then you have a higher chance of getting breast cancer. And if you had late menopause, so if you had menopause after the age of 55, then you have a higher chance of getting breast cancer. And that's because the breast cancer is linked to estrogen. So the more estrogen that you've had, so if you had your period early, then that means you started getting estrogen earlier. If you kept your period later, then that means you kept the estrogen around longer, then that means you had a higher incidence or higher chance or higher risk of getting breast cancer. All right. Childbirth. If you have your first child at an older age, or if you've never given birth to children, that increases your risk. Breastfeeding, if you didn't breastfeed, that can increase your risk as well, because we do know that breastfeeding actually lowers your risk of getting breast cancer. And then hormones. So if you are on hormone replacement therapy, or if you're taking hormones, what we call unopposed estrogen. So some people, like when they're getting hot flashes and they're getting menopause symptoms, they want to go get started on estrogen. Well, I've got a lot of ladies that come into my office and they say, "Doc, can you put me on estrogen?" And I'm like, well, we don't really want to keep you on what we call unopposed estrogen. Birth control pills have estrogen and progesterone. So the progesterone helps to balance out, and so you're not just getting the estrogen. When you just have estrogen, you have the higher risk of breast cancer. I do try and explain that to my patients. If they do agree to still want to get on the estrogen for those symptoms, of course, like I said, we try other things things first, because we don't want to give the estrogen if we don't have to. But if they still want to do it, I make sure that they're aware of that increased risk of breast and ovarian cancer from unopposed estrogen. All right. There's a couple more risk factors that make you have a higher risk for breast cancer. If you have a lack of physical activity, if you don't exercise, if you are more sedentary, then that increases your risk for breast cancer. If you have increased stress levels, you have an increased risk. If you have a poor diet, if you have a diet high in saturated fats, if you're lacking in fruits and vegetables, then that can also increase your risk for breast cancer as well. All right. If you've had radiation exposure, let's say you work someplace where there's lots of radiation, that can also increase your risk. Being overweight or obese also can increase your risk of breast cancer. Drinking alcohol and, like I said, the hormone replacement therapy can increase your risk. Now, let me just also throw this in here. 60 to 70% of people with all of those risk factors that I just read off, they don't get breast cancer, okay? And then you've got some people that have none of those risk factors that still get breast cancer. So those things that I just listed are just some of the things that can increase your risk, okay? Just because you don't have them doesn't mean that you won't get it, and just because you do have them doesn't mean you will get it, all right? So what else can we talk about breast cancer? So ladies and gentlemen, we recommend, it used to be more recommended that you do your own self breast exams. Now we're not recommending it quite as much unless you know what you're doing. So you need to actually go to see your doctor and make an appointment and ask them to please show you how to do a breast exam. All right. It is something that you need to learn how to do correctly, because a lot of women don't know what they're looking for or how to do it. So you should pick one time a month. A lot of people pick it that week before their period comes on or the week after the period goes off. You can have some tenderness of the breasts the week of your period, so it's not probably a good idea to do it that week. But maybe that week after your period, you certainly can do your regularly scheduled what's called a self breast exam, or a SBE. And when you do that, you want to first examine the breast with your eyes. So you want to look. So you want to stand in front of a mirror. You want to, of course, be with no clothes on. So you want to hold your hands up above your head. You want to raise up your arms so that the breast can actually lift. You want to see how the breasts are being suspended or being held up. Make sure that one is not changed in how it's being either higher or lower than usual. You want to make sure that the size is about the same as usual. Most women, most people in general are asymmetric. So usually one breast is larger than the other, but it shouldn't change over time. So if you're noticing that one breast suddenly is larger than the other or suddenly is smaller than the other, that would be some signs that maybe you need to go in and see your doctor to get more of an examination or a workup done. So you want to raise your arms up and look. You're also looking for any color change to the breast. You're looking for any skin changes to the breast, any dimpling or puckering of the breast. If your nipples were always pointed out and now one or both are pointed in, that's a change. And any change is something that you should go and get checked out. You want to, of course, look for any other abnormalities that you can see. All right. So that's how you look first. After you look at the breast, then you want to feel. And you can either do that, like I said, again, standing up in that position, or you want to lay down. You still need to bring your arm up above behind your head. You want to start, if this is your breast, you want to start on the side, and you do want to examine what's called the axilla, your armpit, because you do some people have breast tissue in their armpit. So you do want to start all the way in the armpit, and you want to go in an up and down motion. Okay, up and down motion. Hey, Raven, good. I'm glad you had your exam. Excellent, excellent. So you want to go in an up and down motion through the armpit, and you're feeling. You're pushing, and you can't just kind of touch. You got to kind of push with a little bit of pressure. All right, so you're going up and down all along the breast. So you can either go in an up and down motion, okay, or you can go in a circular motion around the breast, okay? And if you go in a circular motion around the breast, then like I said, you still want to get that tissue over in the armpit as well. All right, so you're doing that. So what are you looking for? That's what most of my patients come in and say, well, doc, I did it, but I don't know what I'm looking for. You're looking for anything that's changed, anything that's different. Now, some women just have lumpier breasts than others. You can actually feel those lobules or those lobes that we talked about. You can feel those. So some women have what we call fibrocystic breast changes, but you need to go to your doctor so that you can know whether or not your changes that you're feeling are normal or not. The other thing that your doctor can do if they're not sure is get an ultrasound of the breast, and they can see if those changes or those bumps and lumps that you feel are normal lumps and bumps. Okay, so you are feeling for anything change, anything new. Let's say you normally feel some bumps, but all of a sudden you feel a new bump that's larger, then you need to go and get it checked because that's a change. All right, you're feeling for anything that's hard or firm. Hey, Pastor Joe, how are you? Good to see you on. Thanks for coming in. You want to feel for anything that's hard or firm, and you want to feel for anything that doesn't move. So a lot of times what we see with breast cancer is it is what we call, hey, Miss Cora, how are you? Thanks for joining in. You want to, breast cancers oftentimes are kind of stuck in place. Normal lumps and bumps in the breast, they're mobile, so they'll move around. We can move them, but if there's a bump that just it doesn't move, it's like this knuckle here, it just stays in one spot. That would be more concerning to your doctor, and then that's when your doctor would want to go and get more testing. Okay, so like I said, let's just do that one more time. Run through. You're looking first. Make sure that there's no changes, no color changes, no skin changes, no dimpling, no inverted nipples. And then you want to feel. You want to feel either in an up and down motion or in a circular motion to feel anything change, any new lumps, any new bumps, any tenderness, any color change, any area of warmth or an area that the skin feels different from the rest of the breast. That's what you're looking for. All right. So if you find those things, now what? Well, now you come in to see the doctor, and then the doctor can do what's called a clinical breast exam, or a CBE. Now, the reason why I always tell you this, you're working with your doctor, it's a team effort, okay? Because your doctor sees you maybe once, maybe twice a year. Typically for your physical is when they're going to do your breast exam. So that's once a year. So you're feeling your breast at least 12 months, right? Because that you're going to pick that week after your period. So you're feeling it. So you know your breast a little bit more than we do. So, but when we do know what we're feeling for in terms of changes. But, we don't know if something's changed, especially like if it's your first time coming to see us. We don't know if it's a change or not. So that's why we want you to do the breast exams if you know what you're doing. All right. If you don't know what you're doing, then you need to go into your doctor and get taught on how to do the breast exam correctly. All right. So let's say we find something. Now what do? Well, we send you for an ultrasound and or a mammogram. Okay. A mammogram is a machine. It presses and compresses the breast tissue. I've not had one yet, but I hear that they're very not comfortable, but they do compress the breast tissue as flat as they can get it so that they can look and see if there's any changes, any lumps or any bumps inside of the breast tissue. Now, sometimes if you have denser breasts than others, then they might need to bring you back for some more views if they couldn't see everything. We do have the capability now of doing what's called a 3D mammogram, which instead of just looking at it straight on, it looks at it from multiple angles. And so with that one, it wasn't that bad. Well, good. Thanks for joining in, Tina. I'm glad it wasn't that bad, and I'm glad you've had one. But I've had some women say that they're quite uncomfortable. So the 3D ultrasound, 3D mammograms can look at the breast in multiple views. Now, of course, the 3D mammogram does cost more than a 2D mammogram. And so if you don't really have a lot of high risk factors, then I wouldn't say everybody just run out and get a 3D. 3D we can reserve for people that have higher risk factors and for people that have maybe had an abnormal 2D mammogram and they need to get more imaging to see a little bit more in the future. All right. So if you get a mammogram and let's say they lumpy humps, well, lovely lady lumpy humps, all right? If you, let's say that they do find something on that mammogram, so what are they going to do next? Well, a lot of times they'll then do an ultrasound because they want to see, is this just a swollen duct? Is this a cyst? Is this something else? So they'll do an ultrasound, and a lot of times if the ultrasound doesn't tell them an answer, then they'll go to what's called a biopsy. So with the biopsy, a lot of times they have you lay on this table, your breasts are down in what looks like a mammogram machine again, and they can go in with a fine needle. And why they put you in the mammogram machine again on the table is because they can look up on the board and see exactly where that lump is at. All right, so they can go in with this fine needle, they can remove some of those cells, remove some of that tissue, and then send that off to the lab to be looked at. Now, what they'll also do at that point is put in a small marker so that in the future, if you have to get another mammogram, if you have to get another ultrasound, they'll see that marker and see, okay, we've already looked at this area and this is the area we've already looked at. It kind of saves them from always having to wonder, did we already check this area out? So the breast tissue from the needle aspiration goes off to the lab. They look at it. They can tell at that point if it's a breast cancer or not, okay? There are multiple types of breast cancer, probably more than I can count here. There's something like ductal carcinoma in situ, there's invasive ductal carcinoma, there's tubular carcinoma, medullary carcinoma, papillary carcinoma. All of those words have something to do with which area of the breast the tumor or the abnormal cells are located in, and then whether or not the cells have spread or invaded other areas or other things around them, or whether or not they're just in one little location. All right. So if you've got, if it does come back that it is breast cancer and it is in one location, what they can do is go in and do what's called a lumpectomy, which is where they go in and they remove that lump. Bada boom, bada bing, it's gone, it's out, it's done, okay? When they do the testing, they also will test your lymph nodes to make sure that those abnormal cells have not spread to the lymph nodes, okay? So if there was no spread and it's just in that one area, they can go in, remove the lump, and you can be good, okay? So there's 3 different types of options for treatment of breast cancer. One is surgery, so a lumpectomy and or a total mastectomy. A mastectomy means total removal of all of the breast tissue, all right? And we see more and more nowadays that more people are opting for a total mastectomy because then they just don't have to worry about it. Okay, there's no more breast tissue, so you can't get breast cancer if there's no breast tissue. We've seen in the media people like Angelina Jolie who tested positive for the what's called the BRCA1 or the BRCA2 gene, went ahead and decided to go ahead and just have her breast removed prophylactic, like before she even gets anything. So that way she knows she's not going to get anything. So we are seeing that more often. So it can be surgical, and then there's radiation, which is basically they get, it's like a big, almost like a laser machine, and they can burn through the tissues and burn the area of those abnormal cells. What the radiation does is it shrinks down the cells so that then if you need chemotherapy, the chemo which is the third type of treatment, the chemotherapy actually destroys rapidly moving, rapidly splitting cells. So cancer is rapidly moving, okay? So the chemo can go in and find these cells that are rapidly moving, and they can target those cells and it kills off those cells. Now, what else is rapidly growing or rapidly moving? Your hair, your stomach lining, and some parts of your skin. So that's why when people are on chemo, they lose their hair, because the chemo gets anything that's rapidly dividing, rapidly growing. So your hair, that's why it makes them sick to their stomach, because their stomach lining is rapidly growing as well. All right. So those are the different types of treatment of breast cancer. It's best if you do get diagnosed with breast cancer that you speak with your doctor about what are your treatment options. We do now have a lot of cancer centers, like Cancer Centers of America, Cancer Treatment Centers of America, and they're excellent at providing options for cancer treatment. And then you can also try other treatments as well, as long as your doctor has approved of that. Things like holistic treatment, but these are things that you'll want to work alongside with your doctor to determine what is the best treatment for you. Okay, so that's just a little bit about what breast cancer is. What are some of the symptoms? I forgot to go over. What are the symptoms of breast cancer? Like I said, a lump that you didn't have before, a lump or a breast tissue that has changed, a change in the shape or the size of the breast, pain in your breast that doesn't go away. The skin changes on your breast, if it's flaky, if it's red, if it's warm, if it's hot, if it's swollen, if it just doesn't look right, it doesn't feel right. Very, very tender nipples. If you have nipple discharge that's not milk, bloody nipple discharge is very concerning. And then what we call involution or inverted nipples. So if your nipples were always poked out and now one pokes in or they start to poke in, that would be concern for breast cancer, and that would tell you that we need to go and get further treatment and testing. So what do you do if you've been diagnosed with breast cancer? Well, I tell folks, first you got to get a good support system. All right, so you want to make sure that you're with a doctor that you can trust, and that your doctor can then refer you to the specialists, and you want to go to specialists that you can trust. Okay, so your doctor is kind of first on your support staff and on your support team. You got to make a team if you've ever been diagnosed really with any chronic condition, but today we're talking about breast cancer. So if you've been diagnosed with breast cancer, you got to get a strong team. So your doctor is part of your team. Your family is part of your team. Families, you got to be there for someone if they've been diagnosed with breast cancer. People with breast cancer or people with chronic disease can go through different stages of grief, because when they're dealing with the breast cancer, they can be angry, they can be sad, they can be depressed, they can kind of be aloof or just act like it doesn't even matter at all. They can cry a lot. They can some days have a lot of hope. They can all of a sudden accept it and be ready to fight it. And then the next they turn around and not want to do anything at all. It's stages of a grieving cycle. And so keeping items in your bra cause cancer. What kind of items? So you can go through the stages of grief. And so families, you need to be aware of that. What I will always recommend is that you ask the person who's going through, what can I do to support you? Okay. Don't just assume that they need one thing. Some people want to be left alone. Some people want to have somebody there all the time. Because you've got to ask, what can I do to support you? All right. Go with them to their appointments. Go with them to their treatments. Go with them when they have to travel somewhere to get more information, to get a second opinion. Travel with them. Go with them. Be there for them. Be there to cry with them. Be there to laugh with them. Be there to smile. Be there to support them. All right. So also, if you've been diagnosed with breast cancer, you'll want to cell phone money rack of lamb. You're funny, Tina. So we don't know for sure. There have been different studies that say that the cell phone and the what are those things the cell phone emits? The emissions from the cell phone, they have said that they can increase the risk, but it's not known for sure whether or not anything can increase the risk. Now, can the pressure and things in the breast, can that increase your risk? It could, but it's not been proven, so we don't know for sure. What we say is probably don't keep anything in your breast, if that would at least lower your risk. Keep anything in your bra, to lower the risk, especially things, heavy things, cell phones, money. Just get a purse or get some pockets. All right. Be safer that way, because we don't know for sure whether or not it causes breast cancer. It's not been a direct link that we know of for sure. All right. So other things, if you've been diagnosed with breast cancer that you can do, you can get mentally prepared. Okay. It's going to be a long road of treatment. And like I said, you can go through those cycles. So you need to have a therapist or a pastor or a counselor, somebody you can talk to. I say get a support group. Get people that have been there, people that know what it's like to go through it, people that have survived, and people that are survivors and can help you through because they've been there. They know what you're dealing with firsthand, all right? And then you want to live a healthy lifestyle. So you're wanting to make sure that you're getting enough sleep, make sure that you are exercising, make sure that you're eating a healthy diet, make sure that you are decreasing the stress in your life, right? Limit your alcohol. Bump up your exercise. These are the things that can help if you've been diagnosed with cancer, because it is going to be quite a road that you're going to have to go through, and you want to be as healthy as you can to go through the treatment process. All right. The promising thing about breast cancer now, as opposed to 20 and 30 years ago, is that we are detecting it earlier, okay? And early detection helps to save lives. Early detection. So find out early if you've got it. Gone are the days where it's like, well, don't ask, don't tell. No. You want to ask. You want to know what's going on with your health, because the more you know, the more you can address it early before it becomes an invasive carcinoma, or before it becomes metastatic. Metastatic basically means it's moved to other areas. So if it's a breast tissue, it's moved to places like the brain, or moved to places like the liver, moved to places like the bones. So you want to catch it before it becomes metastatic. All right. So what can you do for prevention? Well, like I said, you've got to go out, you've got to do your breast exams, and you've got to go get your mammogram. All right. I recently had a patient that called me and said, Doc, Dr. Nicole, I don't know, I've lost my insurance and I don't know how to get a mammogram because it costs a lot of money. I don't have insurance anymore to pay for it. And so I actually went and did some research for her and found that there are places here in South Carolina. I'm talking now to people in South Carolina because that's where I looked. And I'm sure that you can find it anywhere. But here in South Carolina, there are centers that can do your mammogram for a discounted price, okay? So if you request a cash option and you want to pay cash, they will give you a discount. Some places up to 50%. I found one that was like 25%, one that was 40% off, and one that was 50% off. So a mammogram, if you pay cash up front, can run you anywhere between $200 to $300, okay? Not as expensive as we thought that it could be, all right? So what if you just still don't even have $200 or $300, but you need to get that mammogram done? Well, we do have some places here in South Carolina that can help you get a mammogram, okay? It's called the Best Chance Network, and your doctor can give you more information on this. I know it's kind of expensive. So now the Best Chance Network is based on a couple of different requirements. Let me pull it up. You may qualify for the Best Chance Network if you live in South Carolina, if you are between the ages of 30 and 64, if you do not have health insurance or you're underinsured, like if your insurance only covers health care or doesn't cover wellness exams or doesn't cover testing, if you have a deductible of $1,000 or higher. So even if you have insurance, but your deductible is like really high, and so you'd have to pay the full price for the mammogram, then you would qualify for the Best Chance Network, okay? If you have, and you have to meet some eligibility income requirements and guidelines, all right? So Best Chance Network is a great program for women, like I said, between the ages of 30 and 64. Now, what if you're over 64? Well, there's another program out there called Wise Woman. Wise Woman stands for Well Integrated Screening and Evaluation for Women Across the Nation. I know that's a lot, right? So it's the Well Integrated Screening and Evaluation for Women Across the Nation. And what Wise Woman does is basically their goal is to provide underinsured or low-income women with screening and well woman exams. All right. So with Wise Woman, they actually offer not just breast cancer screening, but also ovarian. They also do cervical cancer screening. So they do your Pap smear and they'll do your mammogram, okay? And a lot of times, the patients that I've sent to the Wise Woman program, it's at no cost to them, based if they're eligible, based on their insurance, on their income. So it's some paperwork involved and some things involved. But I say all that to say, don't lose hope, ladies. Even if you can't afford the cash pay prices, there are some other programs, the Best Chance Network and the Wise Woman program, that you can contact, and you go through your doctor and they can help you to see if you are eligible and qualify for these programs that can help you with the screening. Okay. So like I said, go and get your mammogram. Go and get your mammogram, because early detection is the key. The earlier we can find it, the earlier we can treat it, and then you can be a survivor and an overcomer when it comes to breast cancer. Like I said, 1 in 8 women will be diagnosed with breast cancer. So we want to do everything in our power to find those women early, and so that we can treat it early. And then you want to live your best life in terms of your lifestyle, so that you can be healthy enough to fight against it and any other diseases that come along. All right. I know that was a lot of information, but hopefully you learned something from it. It is October. It's Breast Cancer Awareness Month. So I hope that you join in with some of the walks that are going to be going on this month, and that we're raising money, because I believe that one of these days soon we are going to find a cure for breast cancer. And we are finding more and more cures nowadays. I can remember back when there was no cure for hepatitis C, but now we have a cure. You take this medicine and it goes away. I believe that in time, with the right kind of testing and research, we are going to find a cure for breast cancer. All right. Again, I'd like to just send out my love for anyone that's been diagnosed with breast cancer. I've had quite a few patients of my own who I've had to break the news to them. I take the time personally when I have to tell my patients to, I bring them in the office, I pray with them, I cry with them, I sing with them, I do whatever I can to just show them my support. And so I would hope that you have that kind of relationship with your doctor as well. But we want to just send well wishes to anyone that's been diagnosed, anyone that's in the struggle. And we want to say congratulations to anyone that had breast cancer and has now beat breast cancer and is moving through and is now being a support for others. And I appreciate all of those ladies and gentlemen out there who do that. All right. So that's all we're going to talk about today. You all know who I am. Again, I'm Dr. Nicole, your board certified family medicine physician. I help people manage and prevent chronic medical conditions, and I explain those conditions in terms that they can understand. Through my books, my seminars, and my concierge medical practice, I help pastors, congregations, and everyday people live their best lives by transforming their mind, body, and their spirits so that they can be better equipped and better informed, so that they can transform the world around them, their congregations, their children, their communities. All right, please follow me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DRNICOLE. No spaces, no periods, no, all the words together, DRNICOLE D.O. And I look forward to speaking with you guys again next week at 3 p.m. Eastern Standard Time for our weekly Talk with the Doc session. This month, some of the topics that we're going to go over are flu shots, urgent care, appointments, and how to know whether or not you can do telemedicine versus going into an urgent care. And we're also going to talk about some chronic conditions such as what was the one that they asked me for? Constipation. That was the one that I had a request for. Someone said to talk about constipation and irritable bowel syndrome. All right. So again, thanks for everybody for joining me, everybody. I'm Dr. Nicole, and I will see you next week for our weekly Talk with the Doc session. Have a good day. Bye-bye.